think he was probably 10 or 11 at the time, and he had never seen an artichoke. And he was a very, very bright young man. So he looks at this artichoke and he says, "Now don't tell me, I'm going to figure this out." And it was so cute to watch him dissect what the artichoke is and how to eat it. And he actually figured it out without us telling him. It was actually, I'll never forget that night. It was really interesting.
That's pretty impressive.
It was. It was always
I don't think as an adult I knew what to do with it the first time I had one.
No.
Yeah. I'll never forget driving the peninsula one time with an old boyfriend, and he says, "What are those?" And I go, "They're artichokes." And he goes, "They don't grow in the ground?" I go, "You mean like a potato?" I go, "No, they're a flower. What are you talking about?" And I thought that was like the craziest comment to make. But if, you know, you're born and raised here, you don't know the difference.
Mm-hmm.
You always had them in your lives.
Well, it looks like we are live on YouTube. So
yeah, the Esalen room is up, but there we go. Mia's working on the camera.
Good.
And then you're still muted, Mia, in case. There you go.
All right, thanks very much for joining us today for our media briefing on a beautiful Friday. We're going to go ahead and get started with our guest today. Reopening tourism was a long-awaited step in our local recovery, and many are wondering how the industry, the tourism industry, is going to balance the needs of visitors with local health and safety. So we're very fortunate today to be joined by two people who are leaders in the hospitality industry. We have Janine Chikarat, who's general manager of the Portola Hotel and Spa and the incoming chair of the Monterey County Hospitality Association, and Rob O'Keefe, who's president and CEO of the Monterey County Convention and Visitors Bureau. They're going to talk with us today about some of the safety protocols that have been put in place and then answer some questions. So we'll get started with Janine. Thanks very much for joining us today.
All right. Well, thank you for having me. I really appreciate it. You know, when the industry first shut down, a lot of hotels and resorts shut down our area. Rob and I and Mimi Han, who's from the aquarium, all got together and talked about what's it going to look like for us to reopen. And the first thing that came to mind, this is very early on, is we need protocols. We need to figure out how we're going to operate and how we're going to reopen. And with MCHA, immediately started working on trying to figure out what these protocols are going to be. And quite honestly, early on, there was nothing out there. I mean, I was drinking through a fire hose trying to find information, and it took a while for the industry to really figure out what we needed to do. And so we started writing our own protocols. MCHA did, and we partnered with Mary Adams, Supervisor Adams, and Supervisor Phillips to bring these protocols forward to Dr. Moreno, and you know, in the event that we were right when the time was right for us to reopen, that we'd have this in place. Dr. Moreno ultimately decided to go with the California Department of Health and OSHA COVID-19 industry guidance. But it was a great exercise for us to go through and also write our own protocols, because we found a local retired infectious disease doctor through community hospital, and she consulted there from 1980 through 2018. So she had experience with HIV, and she just brought a wealth of knowledge to the table and helped us guide it. So once Dr. Moreno signed off, we got to the point where, okay, we need to customize this for our individual businesses. So, you know, each company has gone through and figured out how to make it work within their own business, whether it's a food and beverage operation or a hotel operation or a combination of the two, or a big resort that has retail and golf and health clubs and everything else. So those steps have all been taken. And as a result, we all had to create training programs. So MCHA created a training program for free and opened it up for not only the members of Monterey County Hospitality Association, but anybody that had a hospitality related business can go online and partake in any one of these trainings. So MCHA has their training, but then we all do. So for example, to give you an idea of what the training is about, it's as basic as starting with what is COVID-19. You know, our employees have been gone for several months and out in the community. We want to make sure that everybody clearly understands what this virus is, how do you prevent the spread, what's proper hygiene, how do you social distance, Then we get into temperature screenings. Some businesses are choosing to do temperature screenings. So what does that look like for your business? Are you doing it for your guests and employees or just your employees? There's some people have chosen to do both, some have chosen not to do it at all, and some have chosen to do employees. So once you get through that, you also end up having to rewrite job descriptions and checklists. It becomes more complex to clean a guest room than it was before, and ensure that you've got all your safety measures. So then, as part of the protocols, you also have to figure out, and which our industry's figured out, is what do we do if an employee tests positive? What do we do if a guest tests positive? So those things are all have been put together in place and for people that are back operating. But then you have to take it one step further, and that is, what are our expectations of our employees and what are our expectations of our guests? And expectations for our guests, or in our operation, and obviously in Monterey County in the state now, is you're going to wear a mask. And if you don't have one when you check in, we're going to hand you one and ask you to wear one. We're signage throughout the different properties is extensive. Anything from proper hygiene to social distancing is on that signage. And then the industry really looked at, how can we reduce touch points? So, for example, in our hotel's not open yet, but when we reopen, we're not going to have valet service. We're not going to have anybody out there. So, we just want to be as conscientious as we possibly can to reduce touch points. And then the touch points that we have, we all have different attendants that are out there constantly sanitizing and being visible and making sure, especially in the large public areas, whether it's a restroom or a lobby or elevators, that they're in place. The last thing is, how do we get to our guests in advance? And we know running a hotel, we have an advantage because we can put information on our website. We can put information in our confirmation letters. We can put information in our pre-arrival letters, and we can also touch them one more time at check-in. So there's a good amount of touch points in terms of communication, I should say, communication points, not touch points, that we have with our customers that we can do well in advance, but also once they're here to reinforce it. So in a nutshell, that really kind of describes the state of the industry and what we've gone through, and with the help of our supervisors and Dr. Moreno, and really looking at some best practices throughout the state and throughout the world at this point.
Thanks very much, Janine, for that really thorough breakdown of what's going on behind. I think a lot of people don't always see that, and now they can kind of know what's going on behind the scenes. Now let's turn to Rob, who's going to give us the perspective from the Monterey County Convention and Visitors Bureau. Hi, Rob.
Hi, how are you?
Fine, and you?
Good, thank you, and thanks for this opportunity. The information that Janine just shared and what I'm about to share, we think is extraordinarily important that we get the word out, because it's critical to the success of the tourism and hospitality success of the destination. And tourism has always been about our community, our residents, quality of life, the dollars that are generated, and we typically speak about those dollars funding local governments and services and things like that. But there's another obligation we have as tourism marketers, and that's to make sure we protect our community. And what my organization's job is to take the things that Janine just outlined and, in a nutshell, communicate those things to people who want to visit here and residents themselves who are getting out and enjoying the destination. So we don't typically focus our messaging on residents, but we're doing that much more. We're doing that now, and we're doing that more than anything else. It's important for us. We have a responsible travel campaign that we've put together, and we've done the campaign in conjunction with local governments to help get the word out. And I think you might have a visual of one if you'd like to share that. That would give an indication of what the messaging looks like. But we're targeting people outside the county before they get here. We're using a variety of means: advertising, public relations, social media, to let them know what to expect when they come here, that you have to wear a mask. Social distancing is important. and all the other things that we want to make sure people, the habits that people need to practice when they're here. And so we talk to them before they get here, and then we talk to them when they're here to remind them to be safe. And this campaign has really taken off. We're working with the city of Monterey to create some outdoor signage, and Carmel by the Sea, Carmel Valley, City of Marina, a whole host of businesses, the Canario Business Association, and they're all taking this messaging and they're utilizing it in a variety of forms. Might be a billboard size message at the Monterey Conference Center, or it might be a flyer that a local business can download and put up on their door. Not all businesses have the resources to create their own material. So we've created that material ourselves, and we're making it available to all businesses. We're a member-based organization, and in the past, we would focus on members, but this is too important. This is something for everyone, and we're making sure that everyone has access to it. In addition to that, we're working very closely with the county, and the county has a very impressive array of tools, communication, and collateral that they're making available to businesses as well. So we're now merging what we're doing with what they're doing to make sure that we have the broadest possible selection for businesses to use, to draw from, to get the word out. We're really fundamentally asking people to change their behavior. And that's not something you ask people to do just once. You've got to ask them to do it again and again and again. You have to remind them, as Janine said, at every communication point and literally every touch point. And that's why we've invested in this program, because we want tourism to come back, but we want to do it in a very responsible and safe way. And this campaign that we've invested in, we foresee it continuing to play out until there is not a crisis anymore. So it's going to be with us, just as the crisis will be, the pandemic will be for a while, so will our messaging. And as other things start to, another area that we're looking at also, and there's a task force for this, is events, groups and events. Obviously, meetings and events are very important to our destination. And so there's been a group that's come together to talk about protocols that would be set for things like the Monterey Jazz Festival or Big Sur Marathon, WeatherTech Laguna Seca, the conference centers. And that group is focused on, as Janine talked about, the protocols to open hotels. That group is working on protocols that span the gamut of types of events and activities, from races to weddings. And as that information becomes available, my organization is communicating that out to the public as well. One of the things that we've seen from research is that consumers want to see things happening. They're looking for signs of safety. And so we're heralding that when we can, to make sure people know that we as a destination, as a community, really embrace responsible travel and promote it. And that's my overview.
Thanks very much, and very interesting, both of you. If you would both stay on the call, we have one more presenter, and then we'll start taking questions from our media representatives. Now we're going to go from tourists over to locals, and how we can get more time with friends and family with the county's social circles guidance. With the 4th of July holiday approaching, social circles may just be the perfect way to have that barbecue outdoors with people you have been missing. And Krista Hani from our health department is here to tell us more about social circles and how they work. Hi, Krista.
Hi, Maya. And actually, Karen Smith, our public information officer, is going to join me on this. We'll tag team somewhat on it. And so, yeah, there'll be just like the hospitality's been talking about, getting the messaging out and about changing behavior. Part of having holidays is how we have a preference for getting together quite often with more family members than our household circle. And so really what the concept is with the social circles is, how do we work on our practices if we do want to get together? So we need to follow the state guidance, if at all possible, which is that we should still stay in our households, go out for our essential work and our essential needs. And we'll also have this opportunity with tourism, to potentially go and explore some of the aspects of our tourism industry locally in Monterey County. And we really had this focus on social distancing in our homes, but we recognize there's already people are gathering and people are getting together. And it's important that as they do that, to have some guidance for guiding that behavior. And sort of, you could think of it maybe as some guidance like guardrails for those social interactions. And we do recognize, from a health perspective, that getting together socially is good for our health. We're a very social species. So social circles and the guidance is just an opportunity for us to come together with good practices outside, and where the two households can be part of the same social circle with a maximum of 12 people, and where they would be wearing still face coverings, still having social distancing. Let me pull up an infographic, or you did it already. That's awesome. Yes, never mind. That was what I was going to pull up. This graphic we have it in English and Spanish. We're posting it, getting it out with the press release. Probably Karen. Karen, can you say, have we posted it already?
No, this one isn't posted yet.
Okay, we'll have this posted.
But it will be.
Shortly. Yeah. And so if you can see, there's different groupings of families, but basically that the adults would be in one social circle and probably be a household social circle. And hopefully you're having that social or physical distancing, you're wearing a face covering. And we're hoping people can do it for 4 weeks. And that's sort of 2 cycles of COVID-19. And then, so as you're thinking about coming together in a social circle, think about the people that you're doing it. Maybe there's a bit of co-parenting happening. Maybe you want to make sure you have that talk over how you are coming together and how you're practicing what you're practicing for your behaviors, as Tom mentioned. And so as you do that, then if you're doing it for 4 weeks, you can think about what are some of the events that might be going on in those 4 weeks. So if you were to be starting this now, then you've got July 4th coming up, and how would you have your barbecue, and what kinds of activities would you be doing? Maybe you'd be out riding bikes together, or having that barbecue, or going out for kite flying, or some sort of physical activity outside. And again, just trying to do that in that safer manner. And as I mentioned, the adults are in one. Children, we do recognize that the children may then also be in an extracurricular group outside. And this could include summer camp, it could include childcare. It may be that they're in childcare and then you have another extracurricular group that they're in. And again, we recommend you follow the state mandate for children that are 3 and over wearing a face covering. But that's also with the supervision, and they're encouraged, especially between the ages of 3 and 12 for that. And then there is other guidance out there as well for childcare and camps from the state that we're hoping that the parents are aware of, and are that the childcare and the camps are following that guidance. And I guess I'd just like to conclude also that, if you are in a vulnerable category, you might want to limit still the circle of people that you have as part of your social circle, because it really is all up to all of us to stay safe, to support each other. And again, we recognize people are gathering, whether we want them, if they do gather, to do it as safely as possible, and help us through our next stage in our response. And this is a bit of a model where we're working to potentially limit the COVID-19 exposure. Karen, would you like to add anything to that? Especially as it relates to events?
No, well, it's just a reminder that, you're gathering with these people, and you do have to have that discussion about everyone. You're only as safe as the least safe person in your group. So you all need to be able to take the same sort of risk when you're putting these groups together.
Mm-hmm. Oh,
it doesn't eliminate the risk, because the virus is out there and we're out and about. it just is a way to help guide you to do some things that you might want to do.
And I would say we're not the first to come up with this idea. We're basing it on it's happening around the world in other countries, and as guidance. Again, recognizing after 100 days in our households, people are itching for a bit more social interaction, and probably are doing it already. We're seeing it, we're hearing about it. So we recommend they stay in their households, and if they aren't, here's an option for giving some of that guidance, as Karen said, for safety.
All right, thank you both very much for sharing that. For a lot of my friends with younger children, date night comes to mind when I think of social circles for some families. So this is their chance. So that's all for our presentation. We've got some questions that have come in on chat right now, and I'll go ahead and ask. The first one is for our hospitality representatives. How prepared is the hospitality industry to scale back reopening should the state and county move in that direction?
I think we'd be extremely prepared. Our industry shut down with very short notice. And I can talk about in our particular situation. I was sitting in my office on a Saturday, and an industry leader called me and asked me what I was doing. And I said, I'm preparing to shut down the hotel. And he said, when? And I said, Wednesday, just randomly off the top of my head. I mean, I was panicked at that point. And to have over 300 employees to plan for a full hotel and get everything shut down by end of day, a few days later, we were able to do it. And I would say I would never want to do it again, but we're at a different point now. So we have some experience in doing it. And I think it'll be something that we could easily do, not easily do, but it's something that we can do should we have to go down that path again.
I would just add that obviously I don't run a hotel, but I work with a lot of hoteliers, and I think it's important to note, while the shutting down, as Janine described, is almost like flipping a light switch. It was all of a sudden, full stop for some. Hotels and other businesses are still scaling up. It's more like a dimmer switch, and it's happening in a very carefully managed way. And we want to get open, and we want to bring employees back to work. But the hotels recognize the situation for what it is, and they're taking it carefully and slowly themselves.
Right. This next question, I think our hospitality reps may be able to answer this. This could be one we also pass on to the county health department. Does the county, or is there a tourism management plan for if and when the current surge starts to overwhelm the hospital and contact tracers? And I think you may have just talked about what the plan might be, which is open or closed. Krista, is there anything from your end that you are aware of, or should we pass this one along to public health?
So this is again one where public health would be working through the Emergency Operations Center and with the hospitality industry. And as Jenny mentioned, there's how do you scale up, scale back, and doing it very quickly. I think it's sort of, to me, a similar answer, wouldn't it be? In the sense that we'd have to be looking at the criteria and the threshold and monitoring that closely, and also working with the state. So the state's also helping as it relates to the surge and more contact tracers.
Okay, thanks for that. Moving on, have any employees in the hospitality industry or guests to local hotels tested positive for COVID? Are hospitality employees being tested?
So I can only answer for my hotel, and we closed down real quickly. We did not have anybody test positive. I have heard anecdotally that yes, there has been some that have tested positive, but in terms of our hotel, we were fortunate that we chose to close so quickly and early on. In terms of employees being tested, again, since I'm not open, the hotel's not open, I can't answer that question. Although I did see something come out from the EEOC the other day saying that we cannot require our employees to be tested in order to come back to work. So I thought that was rather interesting.
And Krista, isn't data broken out on our COVID-19 page as to industries? So it could be that there's information on that
Correct.
available
Yes.
on the COVID-19 page.
Yes.
Going on to our next question, this may be for Krista or for public health. How do you account for the risk of a summer camp of 12 children plus staff, which each come from a social circle, meaning the combined risk for everyone involved is a mathematical equation equaling 156 people, not just 12 people? Are children considered low risk for linking COVID-19 between social circles?
The latter question, no. And for the numbers, again, we're recommending people consider and have a maximum number of social circles. And again, where it's outside and where there's this social distancing, where people are wearing face coverings, these are all factors that play a role in reducing the potential for transmission. And that's
also,
really the guidance is about that.
Right, and if I'm recalling correctly, social circles don't prevent the spread of COVID-19, it just reduces the potential impact on a group, correct?
The potential, yeah. And hopefully, ideally, again, where folks are in the groups for up to the 4 weeks, that's part of reducing that potential.
Okay. All right, moving on. What are the plans for testing sites in Monterey County, such as Greenfield, Salinas, Monterey Peninsula College? How long will they be able to collect samples? I don't know if we have anyone on the call who can respond to that one. No, and we can pass that one, we can forward that one to public.
I can kind of answer. This is
Thank
Karen.
you. Great, go ahead.
So those are 2 state-supported testing sites, and the state has extended their contract to the end of August. However, that does not mean that funding will continue through the end of August. So that's where those are standing right now in terms of state support.
And Karen, is there a comprehensive list of all testing sites, including pharmacies, available? I know on our website we have the 2 state sites and MPC. No. Okay. I'm not sure we have that, but if Karen has more information, we can send it out. And then our last question so far are this maybe for public health again. Are hospital staff, field nursing patients, and staff being tested, and is repeat testing happening? What about members of the public receiving repeat tests? How long will the state support this kind of testing?
So I'd have to follow up on the aspects of the hospital staff, and it is that they are their own sector as well. Correct. And following different guidances. And we're also about how long the state will support right now. And Karen was there, I believe it was covered through the end of August. And we're looking at how and possibilities for how that can be extended by the state and then or by us.
And thank you for that. And that is all the questions that we have got in on our chat. Is there anyone on the line who wants to ask a question the old-fashioned way? Hearing the sounds of silence, I think then we have covered everything. Thanks very much all of the presenters today for providing information, and have a great weekend.
Thank you very much.
Thank you.
Thank you.
Thank you.